Yeah, it's a very good and very timely question. The COVID, after 3 years, really have a destructive force to not only at the medical education, but the whole health system as a whole, globally. And if you look at the COVID, it's not only not allowing the student to have access to personal teaching. I'm talking about especially in the field of medicine, because in the foundation medicine, you'll be able to at least get into seminar, or you can get some textbook or internet access. But the trouble for the clinical rotation, as were the challenges in the past 3 years. Especially at that time, I was in Canada, and my medical school back in London, Western Ontario, we have to stop the students coming to the campus. Same in China and in Shenzhen. So what happened for us is accelerate the artificial intelligence, the AI learning, the modality actually complements some of this shortcoming in the COVID, because we're not allowing access, exposure to the foundation teaching as well as to the clinical teaching. Now, there are this acceleration because of the AI, we call that, is encompass a very vast field. So in a sense, the COVID gives us some very, very good lesson how to characteristically propel the uptake and diffusion of AI into medical education and in healthcare. Give for example, our students now be able to read and get access to AI-defined data set for anatomy classes. You don't need to have the whole dissection on a cadaver or an anatomy. You'll be able to get some AI, even VR, for surgery. Some of our platform for surgical rotation will be able to get the student to perform the surgical procedures on a VR. So those are positive thinking for the new generation of students benefiting. But the downside still, we don't want to forget, is the patient and people-to-people interaction as a doctor. As a great doctor, you must treat the patient with the disease. So we do want to emphasize the importance for student engagement with patient, with the dialogue with the family, and look at the social determinant of health too. So this COVID gives us a very good lesson both in the medical field, in education, also in the healthcare field. Now that's also a very broad and deep question. The reason I say that is also one of the reasons that I came back or came to China, to Shenzhen, because of a new medical school being planned at the CUHK-SZ. This is a foreign mainland established medical school with the CUHK-SZ in Hong Kong and the CUHK-Shenzhen and the Shenzhen government. So this is merging or integrating West, Mid-East. So why this is different? If you look at the global aspect, at the current status in our medical education, we don't have enough doctors. China particularly, with the one-child policy and the aging population, we are much more in the abnormal configuration compared to the global world, which is a pyramid shape. They have immigration to support the elderly. China, we don't have. So we actually in a big shortage of competent, excellent physicians, but also specialists in China to fulfill the burden for healthcare. So we must do it right so that our economy, our GDP won't get pulled down, which is already happening in North America. We see the GDP get pulled down by the healthcare burden. So the West, Mid-East allow us this platform to bring in the artificial intelligence, professionalism, data science, biomedical engineering, bioethics into the curriculum in the East, in mainland. In Hong Kong, it's a system for the British MBBS system by tradition, 6 years training. Mainland, majority were 5 years medical school training. There are some are 5 plus 3, there are some 4 plus 4. By and large, what is the current status is not able to generate or produce enough numbers of physicians, but also quality physician. So what I try to do with the West Mid East is to bring the platform from the Hong Kong, which is part of China, integrating with the North America, where I came from in Toronto, into this platform, allow us to develop the best of both worlds, so that our student, through the 6 years training in CUHK-SZ, allow them not only to access the Western Hong Kong MBBS system, but also our mainland and North America. So that will allow us to propel and build a platform for new generation of doctors that understand data science, biomedical engineering, bioethics, professionalism. I don't need them to be engineering coming out, but I need them to understand so that when they go to the hospital, they'll be in the cutting edge to deliver the best health care for our population and for our nation. This question is you bring me back my memory lane. So when I thought of being a physician is when I was a child, growing up in Hong Kong, my maternal grandfather, he's a Chinese doctor in Hong Kong practicing. So I grew up in a medicine environment. So I'm very admire and really seeing this as a noble profession, number one, is able to help people. And also from the status as a physician, you don't have to worry about unemployment. There's a job that will never need to be laid off because there are so many things you need to be done for healthcare, and there are so many things you can do for training and developing the new generation of doctors. So I choose to become a doctor. That's where I enter into the medical school at the University of Toronto. And then my specialty in Toronto as well, and run the largest intensive care in Toronto as well. And also came back is to hopefully contribute myself to at least add to the value, how to educate and bring the new generation of doctors in the Greater Bay Area, in the Guangdong Shan, in the mainland.